Thank you. Hi, everybody. Today I want to start my presentation off with my tagline. Healthy, beautiful smiles start here. It's no coincidence that the word healthy comes first, because in my clinic, my first focus is my patient's oral health. My topic today is cancer. This is a very scary topic, I know, but I'm sure you've heard lots about breast cancer, lung cancer, and more recently, HPV-associated cervical cancer. But did you know that HPV is linked to another deadly form of cancer? That's oral cancer. Oral cancer is the number 6 most common cancer in North America. And 32,000 people, that's how many people is going to be diagnosed with oral cancer in Canada this year. And more people die from oral cancer than skin cancer and cervical cancer. So who remembers the show Siskel and Ebert? Well, Roger Ebert had oral cancer. Fortunately, though, he's a survivor because when caught early, oral cancer has very high survival rates at about 83%. Unfortunately, though, oral cancer treatment is very destructive. Oral cancer has left Roger Ebert disfigured, without a lower jaw, and he's unable to eat or speak. And the most unfortunate thing about oral cancer is that it's preventable. Up to 84% of early cases can be detected early by your dentist. And screening is simple, quick, and completely painless. So what is oral cancer? Well, it starts in the cells of your mouth, and this includes your lips, your tongue, your cheeks, the roof of your mouth, and the back of your throat. It can look like a red patch, it can look like a white patch, it can look like a lump, or it can look like an ulcer anywhere in your mouth. But these lesions, they'll last longer than 2 to 3 weeks. Symptoms of oral cancer also include a cough that won't go away or difficulty swallowing. So how do you screen for oral cancer? Let me introduce you now to the VELscope. This is a revolutionary tool which allows dentists to visualize abnormal cells inside your mouth. What it does is it emits a fluorescent blue light into the mouth, and this causes healthy tissue to glow a bright green color. Whereas pre-cancerous tissue, they'll show up like a dark spot or a dark shadow. The main goal of a VELscope exam is to identify pre-cancerous tissue. And normally this tissue can look completely healthy and normal under regular white light. So what you're going to watch now is an oral cancer screening.
During every new patient and recall examination, I'm looking for oral cancer. I'm looking at the skin for any pigmentation, scarring, or moles. And then I palpate the soft tissue, looking for any bumps or lumps that shouldn't be there.
There's lymph nodes under her chin and under her jaw, and I'm trying to see if the lymph nodes are enlarged or if they feel bruised, which might indicate that an infection is present in the head and neck.
Inside the mouth, I'm looking for oral cancer on the soft tissues. That includes anything that's pink.
So inside the lips, the cheeks, the tongue, the roof of the mouth, I'm looking for any sores or ulcers, any inflammation, redness, or bleeding. I also check the tongue. So I'm checking along the border of the tongue and underneath the tongue. Again, looking for any lumps or bumps that shouldn't be there. A VELscope is a great tool that helps to screen for oral cancer. Essentially, the intraoral exam is repeated using the VELscope. The fluorescent blue light shines into the mouth, and all the tissues are viewed through the VELscope handpiece. I am looking for irregular, dark areas in the mouth, which may indicate pre-cancerous tissue. So who's most at risk for oral cancer? Well, if you have a long history of smoking or alcohol use, if you've ever really had a bad sunburn to your face or your lips, or if you're a woman between the ages of 20 and 29, you really should have an oral cancer screening done. However, considering that oral cancer is on the rise and screening is so simple, wouldn't you want your dentist to do an oral cancer screening at every single appointment? Well, I do. When you come visit Kits Family Dental, we perform an extraoral exam, intraoral exam, and a VELscope exam with every new patient and recall appointment. And since April is Oral Health Month, I want to invite everybody here to come in for a free VELscope examination. Come visit me at Kits Family Dental because healthy, beautiful smiles start here.